In the late 19th century, surgeons and nurses usually had operations with bare hands. To achieve aseptic practice, they had to repeatedly scrub their hands and arms before surgery with highly irritating chemicals. In 1889, Caroline Hampton, a surgical nurse at Johns Hopkins Hospital, developed severe eczema and peeling skin from these disinfectants. The condition became so serious that she considered leaving nursing. To protect Caroline's hands, surgeon William Halsted asked the Goodyear Rubber Company to create thin rubber gloves to protect her hands. Halsted soon discovered that wearing gloves during surgery also significantly reduced post-operative infections. By 1894, Halsted's student Joseph Bloodgood began requiring the surgical team to wear gloves. The era of sterile surgical gloves had begun. In 1965, an Australian company invented the dipping process that enabled the affordable mass production of disposable latex gloves. Gloves gradually became single-use products. Before the 1980s, mainly used in operating rooms rather than for routine examinations, injections, or blood draws. The AIDS epidemic transformed medical protection. Healthcare workers realized that even a tiny wound could become life-threatening if it came into contact with a patient's bodily fluids. In 1987, the U.S. Centers for Disease Control and Prevention issued the historically significant Universal Precautions Guidelines. These guidelines required gloves to be worn whenever there was potential contact with any patient's blood or bodily fluids. Global demand for latex gloves rose rapidly. To keep up with demand, many factories shortened the process of washing out latex proteins, contributing to the latex allergy crisis of the 1990s. This accelerated the search for alternative materials. In 1990, inventors Neil E. Tillotson and Luke G. DeBecker filed a patent related to synthetic elastomer gloves, marking the official birth of modern nitrile gloves. By the mid to late 1990s, nitrile gloves began entering hospitals on a large scale. To help doctors instantly distinguish them from yellow latex gloves, early nitrile gloves were deliberately dyed blue or purple. Entering the 21st century, advances in material science continued to drive innovation. New synthetic materials emerged. Specialized food-grade gloves, cleanroom gloves for high-cleanliness industries, the more convenient SafeDon, the laboratory-oriented ChemTough, the more eco-friendly Syntex, and the softer SynMax Pro gradually appeared. For more than a century, disposable gloves have evolved from natural rubber to latex, from single-use gloves to nitrile and new synthetic materials. The history of disposable gloves is also the history of humanity's growing understanding of risk, the building of protective barriers, and the safeguarding of health. Disposable gloves have now entered an era of specialization. What began as an effort to save one nurse's career laid the foundation for 125 years of innovation in medical hand protection.
INTCO Medical.